right, good afternoon. Welcome to Thursday's press briefing here for the Emergency Operations Center at the Blackhawk County Emergency Management Agency. Today's press briefing will cover a lot with regard to our geriatric community, our elderly and aging population. We're going to start off, as always, with our emergency management or Emergency Operations Center Incident Commander and Director of the Department of Health, Dr. Nafissa Cisse-Egbounye.
Good afternoon, everyone. As Sheriff Thompson stated, a focus of today's press conference are those in our community that are most vulnerable. Of the COVID-19 cases in Iowa, approximately 10% have been in long-term care residents or staff, and approximately 40% of deaths reported in Iowa have been residents of a long-term care facility. When a reported case is connected to a long-term care facility, our health department works with the facility to contain and prevent the spread of the illness within the facility and to monitor for additional cases. So before we hear from some of our long-term care partners, I'd like to provide an update on the number of cases reported for Blackhawk County. There has been 9 cases of COVID-19 reported in Blackhawk County since our last press conference, and simply put, the number of cases in Blackhawk County is increasing. This is the start of a surge that we've been preparing for. Now, more than ever, we need all Blackhawk County residents to please stay at home. So stay at home as much as possible. Governor Reynolds has communicated that. It's so important for our residents to stay at home and please only go out for essential needs such as grocery store or medicine. We really need you to stay at home. So if you're not staying at home, also one of the things we've recognized is that people are still gathering. So we need people to practice social distancing at all times. So if you need to go out, still practice social distancing and staying 6 feet away from other people, avoid groups larger than 10 people, and return home as possible. If you are ill with fever or cough or other respiratory symptoms, you need to stay at home and isolate yourself from other household members as much as possible. You need to stay at home for at least 7 days after the start of your illness, and you have not had a fever for 72 hours, and your symptoms have improved. You need to call your healthcare provider in terms of how to manage your symptoms, or if your symptoms worsen and you need to be seen. If you have a family member who is ill or anyone else who lives with you is ill, you need to stay at home. You need to stay at home for 14 days after your last exposure to the ill person. If you become ill, contact your healthcare provider for how to manage your symptoms again and stay at home once again for at least 7 days after the start of your illness and you have not had a fever for 72 hours and your symptoms have improved. To our business partners, now is the time to take precautions to protect your staff who are still working by having all ill staff stay at home. So we need businesses to please, if you have ill staff, people with mild symptoms, please be flexible and allow them to stay at home. Following self-isolation guidelines will be very important for all employees, and promoting social distance by staggering shifts, promoting telework and others in separation of staff. So the Iowa Department of Public Health also released new guidance for businesses last night, and that guidance is available on their website. And again, I just want to echo the importance of staying at home. I know that we don't have that at the moment in a proclamation, but Governor Reynolds has been communicating for people to stay at home. We need people to stay at home. By staying at home, you are saving not only your life, but the lives of others. This is not a time to promote fake news of whether COVID-19 really exists or not. It's real. It's very real. People are dying. People have been impacted by this. We know and understand how, how difficult it is to stay at home. We've been at home during winter, and so the sun is coming out, and people want to spend some time outdoors. But please stay at home and only go out if you have essential needs, such as grocery, getting medicine, and even within that context, you have to practice social distancing. These are the only measures that will help us save lives. And I thank you all for just continue practicing those mitigation measures. As you can see, our numbers are not as high as those other counties that have been impacted, but we have to continue our mitigation efforts. We cannot have our guard down. This is the time for us to really practice that staying at home. We're getting ready for the surge. We haven't, our curve, at least in Black Hawk County, has not flattened. And so we need you all to stay at home and practice social distancing as much as possible. Thank you.
I will carry Dr. Nafissa's comments one step further. Obviously, this is our last press conference before the weekend, and we recognize this to be a significant weekend in that it is the Easter holiday, a time where families want to get together. They want to have the Easter egg hunts. They want to have the big family meals. They want to have those get-togethers, which right now, unfortunately, this is not a smart time to do those kinds of things. And so I echo the concerns. I also echo the sentiment that Dr. Nafissa brings with regard to this being a time where you may want to try and exercise different technology to spend time with family. You may want to try and find other ways to do that from a distance. Also, we still understand that there are people that just don't take it seriously, and it's because of those folks that we continue to see community spread. And unfortunately, there are innocent victims that are finding the virus in them simply because they've come in contact with people that didn't take it seriously. So you're not just doing it for yourself, for your own family, you're doing it for all of us when you socially distance, when you do stay at home, when you do stay out of public circulation. These are important steps that everyone can take, and it's all for public safety, all for public good, and that is important for all of us. Next presenter will be from Friendship Village, actually. She's the Executive Director and Vice President of Health Services, Ms. Sherry Turner.
Hello. So today I wanted to share with you what we've done at Friendship Village to keep our residents well. We have really closely followed the instructions from the Iowa Department of Public Health. We've consulted with our own Black Hawk County Department of Public Health as well, and we're getting a lot of guidance from CMS, Center for Medicare and Medicaid, along with places like Leading Age. Leading Age is an advocacy agency for long-term care facilities, and they've really been great with providing as much information as they can for us. So the amount of information coming from such groups like Leading Age includes many links to all of those great resources like the public health organizations, information from World Health Organizations, and many experts. What we've done specifically at Friendship Village is we've followed the mandates to quarantine our skilled long-term care facility, and we went ahead and included our assisted living right away at that time, along with Rosewood Estate, which has home health services on site and has some very vulnerable people as well. So we went ahead and took that extra step right away around the March 13th information that came out concerning quarantine. We've also assembled a list of nurse leaders along with our CEO, Lisa Gates, and we've created a coronavirus infection control team. So every day we meet at 8 o'clock and we discuss all of the problems and concerns. We put together a plan for PPE. We put together policies that we need in our buildings. We discuss what the sickness is amongst our staff. So far, we haven't had any coronavirus at Friendship Village. We haven't had any among our staff, so we feel very fortunate. but we know that could change at any time, so we remain diligent. Another thing we've done is we've created a resident watch list early on so we can follow those people even in independent living. At the beginning of this, a lot of the independent living folks had been traveling. They had been vacationing. You know, when this first was announced, many people were flying back from many different areas. So we created a watch list of those folks and really reached out to them immediately when the coronavirus crisis information began. And we followed them to make sure that 14-day quarantine was followed. We really encouraged them to stay in place and provided them as much information and reaching out to them as we could. We immediately followed the mandate to stop communal dining in dining room activities and any activities that are greater than 10. We even narrowed that down even further as much as possible. We also assembled our dining team and came up with solutions to offer room delivery to all independent living, actually all areas. We just went straight to providing those meals directly to rooms and apartments. We selected our most effective cleaning products, and we equipped our staff in housekeeping to continue to clean everything we could, and anybody that can help, we enlisted the help of all of our workers. We've had brainstorming meetings to discuss what other activities can we do. Our people, we don't want them to feel isolated. We want them to still have quality of life. So what we had to do was, whenever we had taken something away, we wanted to replace it with something else. So those one-on-one activities in someone's room or apartment, if you check out our Friendship Village website, we have some really interesting activities that we've done to try and supplement, because we really know that this takes a toll on our elderly that feel isolated. We have followed the recommendation to discourage visitors in our independent living and have taken it a step further and have restricted all visitors into our independent living facilities. We have even rerouted vendor deliveries to backdoor areas so there's less contact. Health screens have been occurring in all the buildings. Most of you have encountered health screens wherever you go in facilities, and we continue to do that in every location. We've also, along with those health screens where you will get a temperature and ask many questions, we also put a copy of the Iowa Department of Public Health testing protocol. So if we have encountered an employee that has symptoms, we can give them that testing protocol that they can then take to their doctor and show that they are an essential worker. They're working with vulnerable people. Please test them if at all possible. We have contacted our state epidemiology lab, and we have received 6 test kits that we have at Friendship Village that will use if we need to. We've talked to our medical director. Our medical director has agreed to review any of those results. We have been in contact with our local hospitals regarding the what ifs. If we were to have someone that exhibits COVID-19 symptoms, where do we house them? That is something that is a big question, I'm sure, from all of the long-term care facilities. We have tried to make individual areas in each building that is dedicated spot for anyone that is experiencing COVID-19. So we have those areas that we've designated. We're working on setting them up so we can house them if possible. But our wish is, of course, that the hospitals will also be able to help us in that situation. We have assigned our health and safety nurse to oversee those health screen areas that I mentioned earlier, providing lots of training, making sure that things are adequately supplied. And we've gone to great lengths at Friendship Village for everything that we're doing. We've installed plexiglass in our reception areas. There's hand sanitizers everywhere. extra cleaning, diligently trying to search for more PPE. There's just not enough for long-term care facilities, so we're hoping for more help with that. We're providing hazard pay across the board to our workers, and we're equipping everyone at Friendship Village with lots and lots of information and support to try and get through this crisis. The organizations such as the Health Department, both county and state, and the Leading Age organization, along with CDC and CMS, have been providing us great information, and we're very appreciative. Thank you.
Our next presenter is the Director of Marketing for Care Initiatives, and Care Initiatives manages several of the long-term care facilities here in Blackhawk County. That is Mr. Jason Bridie.
Well, thank you. Good afternoon. My name is Jason Bridie, and I am with Care Initiatives, an Iowa-based nonprofit owner-operator of 5 entities here in Blackhawk County: LaPorte City Specialty Care, Northcrest Specialty Care, Pinnacle Specialty Care, Ravenwood Specialty Care, and a hospice service called Care Initiatives Hospice. I'll be speaking on behalf of all 5 of these entities regarding the efforts we're taking to keep our residents and staff members safe during this COVID-19 event. I'll also comment on the personal side of the care being provided within our walls. I would like to echo much of, in many of the comments of Ms. Turner of Friendship Village. The long-term care industry, working with our member the associations that we belong to. Iowa Healthcare Association is an association of members that we belong to. I know they've been working with Leading Edge as well, and many of the recommendations that were just mentioned are a lot of the same things that we've been implementing as well. So I might repeat a few things, but I do want to give you some of the personal side of some of the what we're all going through inside the building as well. First off, since early March, we've taken many precautions to help prevent resident and staff exposure of the COVID-19 virus. 1 month ago, I looked back and it's hard to believe it was just about 1 month ago that we implemented our no visitor policy, which meant only facility employees were allowed inside the nursing home, plus in certain compassionate care situations, such as an end-of-life situation, exceptions have been made to allow family members to be with loved ones at that critical time. Other preventative measures we've implemented include screening our employees for illness before entering the building. That is, I believe, not only a recommendation, but a requirement and a directive now, and a very prudent one at that. We've stopped communal dining, as was mentioned earlier, and all group activities. And just in the past week, we are requiring all direct care employees to wear a mask and a face shield at all times. And that, of course, is dependent on availability of PPE, but we certainly are doing our best in getting our supplies procured. And right now, I think we're doing pretty well, but we could always use a little more. We've also been preparing our facilities and our staff should any location experience a positive COVID-19 test. We too here in this area in Blackhawk County have not recorded a positive test inside of any of our facilities or with any of our hospice patients. So we're very fortunate at this point. We've been procuring and building up supplies of the personal protective equipment, or the PPE. We continue to emphasize the value of hand washing and the use of hand sanitizer amongst our residents and our staff. And should COVID-19 find its way into one of our buildings, we do have a plan that includes isolating positive residents into a separate section of our buildings to provide the necessary care and to help prevent further exposure. That has been a recommendation, and a wise one at that we've all received from all of our from departments of public health and others. And we have gone ahead and identified beds and areas of buildings where we can isolate as well. Although our Care Initiatives hospice team works remotely wherever their patients reside, our hospice nurses and aides are donning PPE as well when entering a patient's room or a personal residence. Our Care Initiatives hospice does not have an inpatient unit, so they serve wherever people reside. In an effort to limit the number of people from the outside interacting with our hospice patients, our hospice social workers, our bereavement and spiritual care counselors are generally conducting their work via telephone for the time being. We've also temporarily suspended our hospice volunteer program. And although that utilizing volunteers is a federal requirement in hospice service, there has been a federal waiver that allowed us to not have to fulfill that requirement. And again, that's a safety measure as well. We want everybody to know how we are coping, and we'd like to tell the real story in all of this, which relates to the sacrifices so many are making to get through this crisis. Our residents understand the restrictions put in place to not take visitors and to socially distance, but they sure do miss the interactions with their family and their friends. Because of social distancing, our residents spend time in their rooms more than they normally would. Our activity staff, they're really doing a great job of trying to keep residents individually active and engaged through doorway games in the hallway, puzzles, books, and providing games in their rooms. With this being an important week, an important Holy Week in the Christian faith, many of our residents are limited to how they can engage with family and participate in some of those traditional Easter religious activities. Although we've done our best to make certain ceremonies and Bible studies available where we can. Our staff members are working hard, and really they are some of the unsung heroes in many, and we've heard throughout the public domain and in media what such a great job healthcare workers are doing and what they're facing. They're doing their best to keep the residents healthy, they're entertained, comforted, and well cared for. They are cleaning, our staff, they're cleaning, they're sanitizing to fight back against COVID-19, and so far, their efforts are working. Our staff miss the interactions with resident family members as well. They miss those folks too. And then there's family members of our residents. We know this has been hard on them. There are many who arrange telephone visits or video conferencing calls. Those are things that we offer to any of our resident families and residents. There are many many loved ones who visit by coming to a loved one's window or talking through the window. We've seen media stories on that, and it's very touching. It kind of tugs at your heart a little bit that that's what we're dealing with in today's environment, but it's a creative way that people have come about to find a good way to interact with their loved one. It's certainly not the same as an in-person visit to hold a hand, but even these alternative visits lift the spirits of our residents. So we do encourage family members to try to do everything they can to either call, video conference, or come up to the window and knock. To close out today, we want to thank our incredible staff and our caregivers, our employee families. We don't want to forget the families of our employees that are they're kind of dealing with this in their own way as well. And our residents and our resident families for their patience and their understanding. We want to thank the community for reaching out. We've had great support from the community, and I could stand up here for quite a while and list them all off, but we want to thank the community for reaching out and offering to help in any way that they can. So we ask you to continue to do that, actually, but we are so very grateful that you have. And we like you all can't wait to get back to a new normal, the old normal. So thank you very much.
We'll now make a slight pivot, and we will start working a little bit more on the medical and geriatric side of this topic. And I'll bring to the microphone the Chief Medical Officer for UnityPoint Health Allen Hospital, Dr. Russ Adams.
Good afternoon. What I want to start off with is to talk about the fact that when we look at persons that are that have COVID-19, that we're looking at higher numbers in the 40 to 60 age group, and then followed by 20 to 40 age group. What that represents to me is that we still have individuals that are not practicing the appropriate distancing. And what happens with that is that it affects our what we call elderly population. Now, elderly by the definition is not what I call elderly, but it says anyone who is age 65 or older. And one might ask, well, why are these people at risk? Well, we see as we mature that we have an increased risk of diabetes, chronic lung disease, heart disease. Our immune system does not work as well as it should, and oftentimes our activities are impaired related to arthritic conditions. And so we have more susceptibility. And so persons that have these maladies also are in the hospitals oftentimes for management of congestive heart failure and pneumonia. When a person who is immunosuppressed because of these illnesses develops the COVID-19 virus, they have a higher risk of having more complications associated with that. Now, as far as the symptoms that a person might have, oftentimes there are no symptoms or there are minimal symptoms. But oftentimes what we will see is a person will have troubles with fever, cough, fatigability, muscle aches, and trouble breathing. Some of these are symptoms that we would see with the flu. Of note, though, is that the flu, that problem is dissipating in our community now. And what we're seeing are people that are not having just the flu. If we look at our facilities, and I believe many of our facilities now, when we have a patient that presents to our emergency department with any respiratory problem, we are thinking that could they have COVID-19? And we are asking all the important questions, but even if a person does not have all the symptomatology, we are oftentimes doing the test to assure. We are trying to, when a person presents with a respiratory illness, we ideally, if they're well enough, we'd like to have them at home with care at home. That's the safest place for them. If they are too ill, then we have a floor in our hospital that is relegated to persons that have COVID-19 or persons that are under investigation. We have our staff at our facility now are wearing masks throughout our hospital, and we are trying to preserve our PPE. And so we're trying to use our PPE appropriately. Most of the persons that come into our hospital have what we call droplet problems, meaning that our risk is related to droplet, not to airborne. And in that case, what we use is usually a surgical mask or a procedure mask, rather than using the more expensive, better mask, which is the N95. The N95 is, we utilize that for patients that have an airborne disease, or that are in a situation where they're receiving CPAP or BiPAP, or they're being intubated or extubated. Those are patients that we're using the N95 for. We're trying to preserve our N95s by using face shields. When we use the face shield, which a number of companies have been gracious enough to supply for us throughout our state and country, that allows us to preserve the N95, which gives us the best protection besides the PAPR with regards to protecting us from airborne infection. Our persons that are at high risk, of course, are people that are healthcare providers that are meeting these patients at the door. And so we, of course, are monitoring all people that come into our facility. Of course, we have a no visitation policy in our facility, except for obstetrics and for patients that have end of life. But we are asking all the important questions. We're checking the temperatures of all people, including our staff. And for myself, where I'm working a 12-hour shift, I have to have my temperature checked 3 times a day. When I first come in, middle of the day, and before I leave. And that's the pattern that we use. We have developed for our patients what is called an intubation team. And the studies show that our patients that have respiratory illness, where they are not responding to our maximum treatment, that need intubation, we need to have our best practitioners intubating. And so our anesthesiologists are part of our intubation team, and they go to wherever an intubation is needed. Right now at our facility, we have 3 COVID-19 patients. They are all in the intensive care unit, and they all are on mechanical ventilation. To echo what has been said previously, the most important thing for us that are not in the hospital is social distancing, and that means that 6-foot distance away from each other. I would encourage all of us that when we see that someone is not practicing social distancing, that we call them out on that and say, hey, you're a little bit too close. When we go to the stores because we have to do our grocery shopping, we should lead by example and practice social distancing ourselves, and make sure that that in our stores that others are doing the same, because that is what is going to cause harm to the rest of our population, our people that are 65 or older, or even the younger people, is that we continue to perpetuate the virus to others because we're not practicing what we have been told to do. Thank you.
Next up, we have a nurse practitioner from MercyOne Health Systems. She works primarily with the geriatric community, and it is Miss Tabetha Gehrke.
Good afternoon. As Sheriff Thompson said, my name is Tabetha Gehrke. I'm a nurse practitioner, and I work at MercyOne with our nursing home population. As been said before, we all know that some of our most vulnerable patients are our elderly people living in residential care facilities. Over the last several weeks, a team of people at MercyOne and several of our local nursing home facilities have developed a process where we can minimize the spread of this virus to this high-risk population with the implementation of several safeguards, one of which is virtual visits. With virtual visits, we can do a face-to-face visit with a patient through a video screen to meet their physical and medical needs without increasing potential exposure of an in-person encounter. The patients can communicate directly to the provider that is seeing them, doing the visits with both audio and visual technology, and additionally, family members can be conferenced in on these visits. This has been very touching for many families and nursing home residents who haven't been able to have any contact with each other for some period of time, and to see that their emotional needs are being met is very touching to be able to be a part of that. We need to commend our great local nursing homes because they have really stepped up to the plate when we asked them to implement this technology. They didn't hesitate. They stepped up quickly, and we really need to commend them for their great efforts. Some of the things I've seen across the various facilities that I've been in, all the medical staff, like they said, are having questionnaires done when they're entering. They're having their temperature taken. Anyone that falls outside of that temperature range is certainly being placed on a quarantine until after 7 days of resolution of their symptoms. All of the staff, as well as myself when I am in the facility, we are wearing personal protective equipment to protect those residents. Some of the facilities, upon entering the nursing facility, they are placed on a 14-day quarantine, and they are doing a twice-a-day respiratory assessment on those patients for the first 14 days. Private rooms are being utilized as much as possible, of course, and as was previously touched on, the meals are being brought to them. Visits into the nursing home have been very limited. I've used the virtual visits myself, as well as several of our providers within MercyOne. Patients are really limited, going out only for urgent needs and subspecialties that are unable to reach them in the facilities. There are also, as previously suggested, some designated wings for patients that would come in with respiratory complaints. Again, I would truly like to commend the local partners that we have in the facilities. They're doing an excellent job of keeping these patients safe, and it really takes all of us doing our part with social distancing, hand washing, and using our technology that we have available to meet these needs of the patient. Thank you.
And batting cleanup today, the Chief Medical Officer from MercyOne, Dr. Matt Seco.
Thank you and good afternoon. I just have a few more additions to what Tabetha said and what we're working on at MercyOne. The aerosol generating procedures, as Dr. Adams was talking about, those are the ones that we're most worried about, that we're using the N95s. And other things we've done is we've built some tents and boxes that we use for intubation to protect the staff in the room, to really help them prevent getting exposed in those cases that we are suspicious of COVID or are positive for COVID as we move forward. Other things going on, the testing. We are following the State Hygienic Lab and the IDPH recommendations. So we still have some limitations, but we are doing more testing. And if individuals think they need to be tested, that they have symptoms, that they need care, again, I know we have the 272 CARES, or set up a virtual visit with your MercyOne provider, and UnityPoint has their services available. So anyone in the community, despite gender, sex, age, or race, we will test you if you meet the criteria. And stay at home, stay at home, stay at home. Really, I see last 2 times I've been here, there's been football games going on at the East High School. I don't think that's social distancing. Think of the NBA players. They shared it amongst themselves. There were so many positives out there. So we need to take care of ourselves. There is going to be a surge in the community. There is going to be needs for a lot of services at the hospitals. And we hope we have enough here to take care of those surges. But please help us with that. If we can flatten this, if we can slow it, that we're not like Cedar Rapids or Iowa City has been through the last few weeks, that we can take care of the people, then that's going to be very good for Black Hawk County. Thank you.
That concludes our prepared remarks for today, pending your questions.
I have a question for Nafissa. So today, the governor and health officials said they believe that they're starting to flatten the curve. You have said that that's not true, at least in Black Hawk County. Can you expand on that a little bit?
Well, as you've noticed, our rates have continued to increase. And so I don't believe that Black Hawk County we're there. And so from the state perspective, they're looking perhaps at the entire state of Iowa. But in terms of Black Hawk County, that's not the sentiment that I share for our county. We need to stay home. I don't want people to have their guards down and thinking that we're flattening the curve. We're not there in Black Hawk County, and so that's very important for clarity.
And Tony, can you talk about the PPE shipment, when we can expect the next one?
We're hoping the next shipment comes in this weekend. It's been accepted and is being filled to our knowledge. We don't know exactly what we're going to be getting. Obviously, every time we make a request, it comes in less than what we asked for. This time, the focus was more on gowns and things of that nature. We are still diligently putting out masks and things from our last shipment, but we're still, I think we've made at least one additional request since this drop that should be coming this weekend. We're trying to stay at least one step ahead. Again, we're having our providers forecast 7 days out, and they're using that green, yellow, red for us. And as we start getting into yellow and red, we forecast again. And so that puts us about every 3 to 5 days on a rotation. And so we're being very routine with that rotation.
I wanted to ask Dr. Matthew from MercyOne, can you talk about the number of patients that you have? We heard from Russell that he's got 3 in ICU.
At this time, we're not going to divulge that information for HIPAA reasons.
We've also been hearing about hospitals having, money issues like other sorts of businesses. Can you talk about if any sort of staff, whether elective or not, is being furloughed at either of your two organizations?
To this point, we have utilized all of our staff. We've redeployed them, and that redeployment is with monitoring the number of people who are coming into our facility, making sure that they have been tested and checked. Also, just making sure that our facility stays as clean as it can be. Also, where we've had persons that used to do nursing but now are doing other types of administrative work, we have introduce them back to nursing so that we can be ready for when the surge comes and there's all hands on deck. Because our biggest concern is that we are not going to have enough workers to take care of the people that we need to take care of. Plus the fact that we expect that there will be a certain percentage of us that will get sick ourselves. And so we are having all the people that will come to work so that we can make sure we're prepared.
Same question.
So we are cross-training a lot of our staff just like they are at UnityPoint. So at MercyOne, we're using those to our advantage. And again, checking at the doors, the temperatures, jobs we didn't have previously. We are doing some low census because the volumes are down without elective surgery. And we are waiting for that surge, and we're trying to keep all the employees rested so that they are ready when this comes.
Can either of you speak to the blood supply, or perhaps how your blood supply is doing currently?
As you're aware, through the country, there's been a concern about blood supply. We've not had any issues at our facility with that at this point in time.
Same.
Okay.
No further questions? All right, so on Monday, based on the numbers that we're watching, based on the forecasting that we're seeing, and based on the realization that even when the numbers drop at IDPH, we know that they're about 12 to 24 hours behind of what we actually know those numbers to be. We have arranged to make sure that we have public health and the hospitals and clinics back on Monday because we do anticipate a significant rise over the weekend. So we want to be able to address those significant numbers and what that looks like as that landscape again shifts for us over the weekend. So that's what we're anticipating having for you on Monday. And without any further questions, that concludes our press briefing for today. Thank you very much, folks.